I've always been involved primarily with the development of bronchodilators and to a lesser extent combinations, bronchodilators, inhaled steroids, LABAs. This study though is a little bit different. This is probably the fifth long-acting muscarinic antagonist, Revefenacin. It's a novel agent, so it doesn't share the properties of the previous ones, such as tiotropium, aclidinium, glycopyrrolate, and umeclidinium. But they're all fairly similar. And this study was what's called a 52-week safety study. To bring a new drug to market in the United States, the standard is to do 3 months, 12 weeks, of a study in parallel, powered on lung function primarily, with secondary outcomes, quality of life, things like that. And of course you monitor adverse effects. This study though is what's called a 52-week extension kind of trial, where you capture a whole year's worth of safety results. So most of the efficacy that goes into the approval is from those 12 weeks, but this 52-week captures then side effects. And one of the side effects that we capture, which is also an important outcome, is exacerbations. This is preliminary though, so it's exploratory. So we captured the exacerbations. And Revefenacin comes in 2 doses, 175 and 88, and the higher dose was associated with a decline in exacerbations. Now what that'll do, if the company chooses to go for an indication for exacerbations, then you design 2 parallel 1-year studies enhanced by people who have exacerbation, and the outcome is healthcare utilization, where this is just being picked up from AEs. So it's not the pivotal, which would be the lung function. But what was interesting is that the population was very reflective of the patients that I see in my practice, namely mostly moderate to severe patients, not very severe, although we had some, and not very mild. And so it looked very encouraging, and we looked at it in comparison to open label TO, which is the gold standard. And there are problems with that design. One's open label, so there's withdrawal biases. Nonetheless, the higher dose on all exacerbation was 17% better and 30% on the more severe exacerbation. So it's a very encouraging kind of study.